Concept of inflammation. Inflammation can occur in any tissue. Two exemplars that we'll look at is appendicitis and inflammatory bowel disease. Other common disorders include allergic rhinitis, Crohn's disease, arthritis, nephritis, gallbladder disease, peptic ulcer. Think of itises as inflammatory issues. Autoimmune disorders can also be included, such as rheumatoid arthritis, systemic lupus, and Guillain-Barré syndrome. So inflammation is a part of a complex response of body tissues to harmful stimuli, damaged cells, or irritants. It can involve the immune cells and blood vessels and molecular mediators. The mechanism of inflammation is basically the same regardless of the injuring agent. The intensity of the body's response depends on the severity of injury and on the reactive capacity of that injured person. The inflammation response can be divided into four: vascular, cellular, formation of exudates, and healing. Responses can be either local or systemic. Local may include things like redness, heat, pain, swelling, and loss of function. Systemic would include leukocytes with a shift to the left, or malaise, nausea, anorexia, increased pulse, respiratory rate, and fever. Other concepts related to inflammation could include infection, immunity, oxygenation, and the need for education of our patients. Inflammation is always present with infection, but infection is not always present with inflammation. What a great way to remember signs and symptoms of inflammation. Hyper: heat, induration, pain, edema, and redness. I would also include impaired function. Diagnostic tests would include erythrocyte sedimation rate, C-reactive protein, WBC levels, and serum protein electrophoresis. Interventions and therapies are aimed at reducing mobility and edema. Examples might include elevation, ice, and medications such as antipyretics, analgesics, antibiotics, steroids, and other anti-inflammatory medications. Specific treatment may also include surgery. Nursing will need to maintain intake of liquids and nutrients for healing to occur. Inflammatory bowel disease. Oh, someone's bowel does not look very happy there. So while reviewing this slide, think about what assessments would you make. Possibly health history to include number of stools per day, pain and or cramping, presence of blood or mucus in stool, usual diet, ability to maintain weight and nutrition, associated manifestations such as fatigue and food intolerances. Within the physical exam, looking at weight, vital signs, abdominal assessment, bowel signs, palpitation for tenderness and masses. So what nursing diagnosis would you determine to be a priority for an IBD patient, and why? Possibly risk for deficient fluid volume, diarrhea, imbalanced nutrition less than body requirements, constipation, acute pain. Alright, so what interventions would you need for these nursing diagnoses? Maintain hydration, IV fluids if the patient is NPO, reviewing nutritional status, using total parenteral nutrition if the patient is NPO for a long period of time, educating regarding diet needs to decrease risk of exacerbation, vital signs to monitor for fluid deficit, being sure to include good skin care, administer prescribed medications, and maintain bowel rest. Complications of IBD could include ulcers, fistulas, anal fissures, malnutrition, pain, hemorrhage, stress, activity intolerance, bowel obstruction or perforation, fluid and electrolyte imbalances, increased risk for colon cancer, and risk for infection. What outcomes would you be looking for as a result in your plan of care? Now let's take a quick look at appendicitis. Clinical manifestations would include continuous mild upper or extreme upper abdominal pain, aggravated by moving, walking, or coughing, rebound tenderness on palpation. Complications could include perforation, peritonitis, abscess, and a chronic appendicitis. These are just three nursing diagnoses that would be included for appendicitis. What others might you come up with and why? Key interventions would include pain medication, NPO, prepping for surgery, administering antibiotics or antipyretics. We must remember to prevent perforation, so we should never give enemas or use a heating pad with a patient with appendicitis, or even if we think they have appendicitis. We would also include IV therapy, and then we would look at post-surgical plans for pain management, wound care, education, and IV fluids.